Okay, so you've successfully collected the sample, you've spun it down, but the job is far from over. Welcome to what I like to call the critical last mile. This is the post-centrifugation phase, and believe me, what you do next matters more than anything.
So that centrifuge dings and the spinning stops. But the 10 minutes that follow, that's when everything can change. From the moment you pick up that tube to the moment it's stored, your actions will directly impact a patient's diagnosis. This is where precision is everything.
All right, first things first. As soon as you gently remove those tubes from the centrifuge, your very first job is a visual inspection. You need to confirm right away that you have a viable specimen, and that all starts with checking the separation. So what are we looking for exactly? We're aiming for a perfect separation. It sounds simple, but it is absolutely critical for getting accurate results. What you need to see is a clean interface, where the serum or plasma on top is totally, completely free of any visible red blood cells.
And this slide shows you exactly what I mean. On the left, that's our goal, an intact gel barrier. See how it's a solid, clean, unbroken seal? Now look at the right. That's a compromised barrier. You can actually see red cells have snuck past the gel and are now in the plasma. You have to be extra careful with tubes from a fixed-angle centrifuge because that gel line will be slanted, making it trickier to spot a breach.
So what do you do if you see a compromised sample? You act immediately. Step 1, you're going to carefully pipette the serum or plasma into a brand new, freshly labeled secondary tube. Step 2, you have to document how the sample looks. Is it hemolyzed, reddish from busted red cells? Is it icteric, dark yellow from bilirubin? Or is it lipemic, looking all cloudy from fats? And finally, make a note of any fibrin strands you see, because those little things can clog up the testing instruments.
Okay, so now that we're sure the specimen itself is good, let's switch gears and talk about safety. Because every single time you open a tube, you're creating a potential risk. And managing that risk is key to protecting yourself and the sample.
Before you even think about removing a stopper, you need to be following OSHA standards, and that's not negotiable. This means you need full face protection. You should be working behind a splash shield or inside a biological safety cabinet. And of course, you're always wearing the appropriate gloves.
So here's the really crucial part, how you actually open the tube. Never, and I mean never, pop the cap off to the side. That's the #1 way to create aerosols. Instead, you're going to cover the stopper with a piece of gauze to catch any potential spray, and then pull it straight up and away from your face. Straight up.
A lot of the time, one sample needs to be tested by multiple departments. That's where aliquoting comes in, dividing that one sample into several secondary tubes. But listen, this process is a high-risk zone for one of the most serious errors in the lab, patient misidentification. To make sure errors don't happen, you have to follow these rules of precision. It's simple stuff, but it's critical. Always use a fresh, disposable pipette for every single sample. That prevents cross-contamination. And please never, ever pour a sample from one tube to another. When you're pipetting, make sure you leave a little air gap at the bottom. Don't touch the cell layer. And as soon as the liquid is transferred, cap that new aliquot tube immediately.
Okay, this is a big one. This is something you'll see on your certification exam, and it's a rule you'll live by in your career. The label on that new tube has to be a perfect, exact match to the original tube. That means at least 2 patient identifiers and the correct specimen type, serum or plasma. There is absolutely zero room for error here.
So our sample is separated, it's aliquoted correctly, everything's good. But now, a clock starts ticking. We're talking about specimen stability. These samples don't last forever, and the way you store them determines exactly how long they're good for.
This chart lays out the general guidelines from the CLSI. That's the Clinical and Laboratory Standards Institute. Basically, if a separated sample is just sitting at room temperature, it's generally stable for up to 8 hours. If you need it to last longer, it has to go in the fridge at 2 to 8 degrees Celsius. And for any storage beyond 48 hours, that sample has to be frozen solid at -20 degrees Celsius or colder.
Now, there are always exceptions, and these are the kinds of details that love to show up on exams. So, exam alert. Certain drugs, like phenytoin or lidocaine, can actually get absorbed by that separator gel, which can make the test result falsely low. For those tests, you need to get the plasma off the gel as fast as possible. Also, never use a frost-free freezer for samples, because its temperature cycles will ruin them. And remember, a frozen sample should only ever be thawed once. One freeze-thaw cycle, that's it. This brings us to our final and probably our most high-stakes responsibility.
What do we do when a test result comes back and it indicates a life-threatening condition for the patient? This is what we call handling a critical value, or sometimes a panic value.
Here are just a few examples of tests that often have these critical thresholds. A potassium level that's too high or too low, a really low platelet count, or a high cardiac troponin. All of these signal an immediate medical emergency. It's your job to be able to recognize these red flags.
And here's where you have to put on your critical thinking cap. You have to connect the quality of the specimen to the result you're seeing. The classic example, and you absolutely have to know this, is hemolysis. When red blood cells rupture, they release potassium, which can make the potassium level look critically high when it might not be. A hemolyzed sample with a critical potassium requires a second look before anyone panics.
When you do have a verified critical result, there is a very strict protocol you must follow every single time. Step 1 is immediate verbal notification to an authorized provider, like a nurse or a doctor. Step 2 is a mandatory readback. That's where they repeat the result back to you to confirm they heard it correctly. And step 3 is full documentation in the lab system, who you talked to, the exact time, and the value you reported. Every detail counts.
So if you boil it all down, your responsibilities after the centrifuge stops really come down to 3 things. Protect the specimen's integrity, protect yourself with proper safety protocols, and by doing those 2 things perfectly, you ultimately protect the patient. That's the whole point. Every single action you take, from checking a gel barrier to making a phone call, is a crucial link in a chain that leads directly to a patient. It is a huge responsibility. So the only question left is, are you prepared to master these steps and own that role?